this is Naruschka Henriques. One of the things I really want to talk about today is about how noses look after being treated. This is a really big question, okay? Lots of people are always writing in and phoning in to find out about when would be the appropriate time to get their noses treated. And the reason why is because usually they have a function or event that they want to look really good for. Usually weddings are a very popular one. Or, you know, perhaps they're going to an event where lots of photographs are going to be taken, and that issue with their nose that they're usually very self-conscious about is something that they want to address so that they can relax and feel comfortable and know that their pictures are going to look good and that their confidence and self-esteem is going to be at its best on the day. It doesn't just apply to people going to events and functions, it also applies to people who just simply want to have this procedure but need to understand what to expect afterwards. So, here's the thing. After having your nose done, okay, you get some people who experience extreme swelling. Usually it starts swelling quite soon after finishing the procedure, okay? So you have those people, they fall into a category of being more sensitive. And then you have other people who on the day probably won't see very much swelling. The swelling will be there, but very subtle. But it will be the following day, okay? So your worst swelling always occurs in the first 24 hours. The following morning when you wake up, that is when it's going to look its worst. So it's going to be more rounded, more bulbous, more prominent. It might even be just very, very sharp looking. It might appear higher than it normally looks. And you might really, you may well think, what on earth have I done? What was I thinking yesterday? But, rest assured, it really is just swelling. Swelling presents in very different ways in different individuals. So it's really important to know that. It may not be in the obvious way that you're expecting. I have had many people give me that call the next day saying, oh my God, I hate my nose. It's really, really huge because the swelling isn't obvious. It looks the same, but it probably looks a lot higher and longer and a lot more prominent than it was on the day when it was treated. And it really is swelling. And I know this because I've seen it time and time again. And usually after 24 hours, you will see a sharp decline in that swelling. Realistically, you can expect swelling to be there for about 3-4 days. And then you get what I would call residual swelling. So it's what remains of the swelling, but it isn't obvious. You'll probably feel that actually it's all gone away and think you have the result until actually a further week later when you realize actually your nose has become that bit more refined than it was at sort of day 4 and day 5. So, it really does take a little while, a couple of weeks, and actually even at 3 weeks or 4 weeks, that can be the point when you really see what your nose looks like. So, I have the following advice for these people. If you have a function, especially if it's a wedding or you have, you're someone who has lots of meetings at work, you've got to be face to face, you've got to look your best, you need to know that people are going to be focusing on what you're saying and not on the end of your nose, then I would say to you, look, give yourself time, plan ahead, don't have this procedure at the last minute. It's not the sort of thing that you want to, expect to look your best in a day or 2. You need to allow yourself some time so that you can go back with all the grace and dignity and know that you're not going to be self-conscious. The other thing as well is if you do have a wedding or an event where actually your looks, how you look is going to be very important, because maybe, all those memories are going to be captured on film and by photograph and you can't really redo them, then I would say, look, don't come in a few weeks before, don't even come in a month before. You really want to come in a couple of months before and have the procedure and then allow yourself to adjust to that change so that you feel very comfortable, okay? And that it's not something that you are self-aware or very self-conscious about on the day, especially when you're having photographs taken. That's the last thing you need. So give yourself lots of time to adjust and lots of time to heal, okay? So that on the day, the last thing you're worrying about is if your nose looks right or if you look like you, okay? So it really is the best advice I can give to all those individuals out there thinking of having a non-surgical enhancement in order to prepare for a function or have hectic and busy lifestyles.